This is an element that's going to be important throughout this entire CBT program. This is the mood scale. The client is supposed to bring in the mood scale every week as homework. And you can see that on this mood scale, it's a 7-day mood scale. And they just rate themselves from worst mood to best mood for the day on average. A lot of clients like to do this right before bed, so I'll encourage them to have their mood scale chart sitting like next to their bed on their bedstand, and that really helps. And what you really want is to have data every single day to try to start identifying patterns, and it's also a good place for the client to start checking in with you and to talk with you about their week. And we had talked about the importance of catching your thoughts, starting to notice your thoughts. This is also a homework that is given a lot, and you can put the thoughts on index cards, with each day being a different index card. So when you have a thought that seems really catastrophic or harmful, you want the client to try to write it down, to remember it, and so that you guys can discuss it in session. So really, a lot of clients find that putting the little card in their wallet or in their back pocket really helps, because this can come up at all times of the day. And really the idea is to notice the thought as soon as you have it and write it down. I want to introduce you to the chaining activity, which is a very important activity that's used in the thoughts module, the activities module, as well as the people interactions module. This is an activity where you try to help them to see the link between their thoughts and their mood. And I have this partially filled in for you here. You always start at number 5, which is an actual event without putting any value judgment on it. So the event is, I just had a fight with my best friend. Then you ask the client, what is a thought that you could have that could make you feel a little bit worse after this event? And then you write that down on number 4. So let's say the client said, I thought that we would never be friends again. You say, okay, that's a thought that could really make you feel a little bit bad. Let's see if we can find another thought that could make you feel even worse. And then we'll put that on number 3. So you say, okay, maybe I thought I would lose most of the friends we hang out with. It's like, wow, that's really sad. You know, that's your whole social life. Let's think about another thought that could make you feel even worse from that. And they're like, okay, well, maybe the next part of the spiral is that I thought nobody would like me ever again. So you can see how each thought can lead you to feel a little bit worse and a little bit more depressed, and it leads to this downward cycle. After taking them through this activity from 4 to 1, then you say, okay, let's go back to the event again. Let's go back to 5. I just had a fight with my best friend. Now let's think of a thought that you could have that's realistic, accurate, complete, and balanced, that could make you feel a little better. So what do you think that might be? And then so the client might say something like, well, I thought that we just needed a few hours to get over it. It's like, okay, that's pretty realistic. That sounds good. What's another thought that could make you feel even better about the situation? And they say, okay, well, maybe I would write her an apology card. It's like, okay, that's great, taking some action on the problem, that's great. So you kind of take them through that and then go all the way up to 9. And then you say, can you see from this activity that your thoughts are directly linked to your mood, and that you can have a choice of having a thought that makes your mood worse, or a choice to have a thought that makes your mood better. And this is a way for the clients to understand the link between their cognitions and the way they feel. And in session 4, which is the final session of the thoughts module, you're really helping them to learn how to have more helpful thoughts. And one way to do this is actually to set aside some worry time. Some clients really find this useful, where they set aside 5 to 10 minutes a day where they can just have their worries and sort of have their negative thoughts, and then time themselves to get out of it. So a lot of clients really find it helpful to use a timer to get out of something like this, but I have to stress that this is not a skill that all clients can use, because some clients get kind of in their negative state and it's really hard to get out of it. A lot of times I'll have the client set a timer and I'll have them do it before they're actually going out to do something anyway. So let's say they already have dinner plans at 6:30. Then they can set their worry time at 6:20, and at 6:30 they still have to go out to dinner because their sister or their boyfriend's going to come pick them up. So that's usually a helpful way to use this worry time, but I do have to stress that it's very hard for clients to use it well. A lot of times they'll schedule it for night right before they go to bed, and that's just awful, because then they'll just stay up awake thinking about their worries. So this is something that has worked very well for some clients, but has to be used with caution. And this is a sample sheet from the program again. This is page 125 of the Thoughts module, and it's the worry time plan if you do decide to use it with your client. So let's go over a quick review of the Thoughts and Moods module. In this module, you're learning how thoughts and moods are connected, and you want to review key exercises with your client. So some of the ones that we talked about today are harmful versus helpful thoughts. Remember, there were the 2 charts that looked at samples of these ideas. There's that chaining activity that we just did an example of. There's the mood scale that they should be bringing back every week. And then there's the worry time chart. At this point, you also want to troubleshoot obstacles and difficulties. What are some of the difficulties or obstacles the client can face if they're trying to use this at home after a session without your help? Is it going to be needing somebody at home to help them with it? Is it going to be setting a time for it? One of the biggest things that affect the success of CBT is trying to plan for these obstacles ahead. So it's really good for the client to try to imagine their week and try to think about the problems that might come up when they're trying to fill out the mood scale, for example, or trying to do the chaining activity at home. And then trying to come up with problems, like problem-solving methods to try to get over that. Finally, you also want to ask for feedback. And this is something that you should do at the end of every session as well as at the end of every module. What skills works for you? What will they take away from the module? What skills and new things did they like best? What things did you do that they liked? And what things did you do that they didn't like so much? That also helps put the client on an equal plane with the therapist, which is something that's really important to CBT, that the client and the therapist are partners and it's collaborative. So you want to give them a chance to evaluate your performance too. Now let's look at Module 2, Activities in Depression. There are also 4 sessions in the Activities module. Session 1, doing healthy activities to improve your mood. So this is where you get them to see the cycle of how activities links to mood. In Session 2, you're helping them to learn how to do a new activity. While some of this sounds very simple, a client who's very depressed can have a real hard time getting together, just even something like showering or getting ready for the day or getting dressed. And some clients really need help with doing a new activity that may actually lead to positive feelings. And so Session 2 is focused on that. In Session 3, you're helping them to troubleshoot obstacles to doing healthy activities. And in Session 4, you're helping them to learn how to do healthy activities to shape their future. So long-term planning and long-term goals. This is really helpful for clients who don't see a meaningfulness in their life anymore, who might have some suicidal ideation. This is a really helpful session for those clients. I've also had the question from a lot of other therapists who've taken this training with me, wondering whether or not they have to do all this content in one session. The answer is no. The guideline is that you do it in one-hour session, but for example, if you're doing a group therapy session, then most of the sessions will last actually 2 hours to get to everybody. And there are certain clients that just have a little bit more of a need to take a little bit more time to get these concepts. It's totally okay if you have to divide up the session into 2 and do half of the session one week and then do the next half the next week. This is all adjustable. These are just recommended lengths, and so the sessions can be done in 12 sessions total, or I've had therapists who have used them in 16 weeks or 20 weeks with certain clients, and that's totally okay too. So Session 1 of the Activities module is titled, Your Activities and Moods Are Connected. So this is the parallel session to Session 1 of the Thoughts module, where you're trying to get them to understand the link between activities and mood this time, and last time you were looking at thoughts and mood. So how do activities help a person's mood? Well, doing activities can make a person feel more positive, can create pleasant thoughts and memories that stay in their head even after the activity is over, gives them a mental break from their worries, and can help them become healthier physically. So here is a picture of the cycle of depression and activities. Next, we're going to look at a worksheet in the page 12 of the Activities module, which is how else does depression get in the way of doing activities? There's lots of reasons that depression gets in the way of doing them. Then you can ask them, what activities did you used to enjoy? What activities did you like before you became depressed? And just write down one activity you used to enjoy. In Session 2, you're helping them to learn to do a new activity. And this is something that focuses on an activity called scheduling. So who needs activity scheduling? Passive patients who have nothing to do can really benefit from this. Patients who are procrastinating, avoiding, or feeling stuck. Patients who are overwhelmed and have too much to do. And patients struggling with suicidal thoughts and impulses. So some of the important points of activity scheduling, which really is just like taking a calendar out and helping them schedule their week. You have to provide a rationale, get the client to find a motivation for them to do these activities. Use questioning to elicit suggestions from the patient. It's a lot easier sometimes for you to just go ahead and suggest it to them, but they're probably not going to do it because they're not invested in themselves. So you really want to bring them in as a collaborator and help them be in charge of their own treatment. Remember to start where the patient is, not where he or she thinks that they should be. So if the client says, I want to climb Mount Everest, but they're having problems getting out of bed and brushing their teeth, then you really have to bring them back a little bit to ground level and help them to find a place to start that is more realistic. Be very specific and concrete. Once they decide on an activity that they want to do, so let's say they say, I want to go to the movies this week with my friend, then you have to ask them very specific questions so that it gets done, like where, when, who are you going with, for how long, what day. The more specific you get, the more likely the client is going to do it. And plan ahead for potential obstacles. So in the case of the client who says they want to go to the movies, start asking them questions like, well, what could prevent you from going to the movies at 6 p.m. on Wednesday? Do you think you might be tired from work? Do you think you might already be at home and you might get kind of sleepy? Like, think about all the different obstacles that can come up and try to troubleshoot them in advance, and that'll also help the client follow through.